Hello, everyone. My name is Walt Schoenborn, Strategic Advisor at SafeLiShare. I'm joined today by CEO of SafeLiShare, Shamim Naqvi, and we have a special guest today, Randall Bardwell, Clinical Advisor for SafeLiShare. We are going to be discussing today securing health information exchanged in the cloud, especially when utilizing clean rooms, and various concerns regarding that with privacy, compliance, and data protection. I want to thank you both for being here today. So really, I want to get some of the overview of data encryption and really where you see applications coming in for clean room technology. How is sensitive health information encrypted during storage and transmission within the cloud?
Yeah, one of the problems that I encountered after working in the healthcare IT business for over 30 years, when I was developing a product that would have interconnections with commercial healthcare systems, I found that many of the data transmission methodologies were fairly ancient. For instance, whenever you send high-speed data to a GE command center from the edge devices to the cloud, you're actually using XML in a protocol they call high-speed data interface, HSDI. So early on, when I was conceiving the thought of a wearable device, I knew that I wanted to use a secure data transmission protocol. And early on, I identified what we call enclave security, which in the device vernacular means that we're connecting a secure protocol actually to the silicon in the device. It's an ARM microprocessor, and they call that trust zone. So you're taking a certificate and you're linking that data in that protocol, so you know that that data came from that device. So that gives you data to cloud security to know that anything that was put together by your device is safely making it up to the cloud. And when I discovered the SafeLiShare concept of the clean room, it immediately dawned on me that that's the perfect answer for the concept of security from the cloud to the end users, because I can provide you with a cyclic redundancy check, a CRC, to tell you that this is the correct data at the cloud. But what do we do after we've passed that data through an algorithm? And what do we do when we want to share that data, for instance, for clinical research? So that's where early on I saw that that was the perfect adjunct to the device to cloud enclave security.
I want to come back in a little bit regarding some of the wearable devices and how the engagement works with regards to encryption, the cloud, and going from there. Shamim, I wanted to come to you in regards to this data encryption aspect of things, where it's specific to SafeLiShare and the confidential clean rooms. I wanted to know specifically on industry standard encryption protocols like TLS and SSL, HL7, MLLP. How are these implemented?
The issue is that these encryption standards are implemented to assure two things. One, the notion of data custody.
Mm-hmm.
And Randy referred to that by saying, when he was talking about the device, that the silicon is tied to the certificate, and the protocol is tied to the silicon through the cryptographic certificate to assure that the data is coming from that device. So the device owns the data and sends the data to some entity in the cloud.
Mm-hmm.
Now, you need to assure that the protocol used to bring the data into the cloud is also secure. And for that, you can use MTLS or any other protocol, FHIR, for instance, etc. But in the clean room case, this would be an MTLS connection. And that assures that not only is the device sending the data in transit was not corrupted or the custody was maintained, and now the cloud has the custody of the data.
In regards to the chain of custody, I wanted to find out some of the details on SafeLiShare's confidential clean rooms and how are the permissions managed in the chain of custody? to ensure only authorized personnel can access the sensitive information that you're talking about, the data that you're speaking of.
Yeah. So the data that is shared in the clean room context is shared through using the public-private key mechanism associated with the recipients of the use. So you only get the data if you have been granted access to the data, and the access is given to you using the public-private key mechanism. It would be too much detail to go into it, but at a high level, if I grant you access to the data vault, then only you can access it, because you are the only party who has the private key to which the grant has been given. So in that sense, the data is always encrypted and is shared using the public-private key mechanism.
In regards to that, I'm going to pivot on some of the multiple facets of confidential clean rooms. I mean, we had discussed previously, and we can touch on it a little bit later, but essentially sharing multi-party collaborations in the clean rooms, which you had just touched on a little bit. I wanted to come back to Randy. Randy, we talked about devices, and that's something that is very much in your wheelhouse. And I wanted to find out the importance of enclave security, clean room technology, things like that in regards to wearable devices in healthcare, and how compliances are adhered to in those processes that go from the patient all the way through.
Sure. Yeah. In fact, I was at an IEEE data sensor security conference last week. And one of the first things that you have to remind everybody of is that physiological data sensors have a mixed data payload that includes binary data. That's what sets them apart from MQTT and your Arduinos and your Raspberry Pis connected to your temperature sensors, et cetera. There's a big difference between sampling an analog temperature once every second versus sampling ECG 500 times per second and applying simultaneously wave shape and filtering to it. So the need to develop a custom protocol becomes paramount, because yes, can you send that data via XML, via other signed integer methodologies? You can, but the most efficient and secure way to do it is to have what we call a mixed payload. So you've got samples of binary ECG, EEG, EMG, and you can also use that for MP3 files, video files, anything that's temperature or very simple. You have to have a more advanced sensor payload, our way of getting that data to the cloud. So that's early on where the concept of enclave security comes in, because it's kind of like making a smart sensor protocol. And so instead of just having a dumb protocol that's going to take data up there, this thing knows where it came from. It's intuitive to know enough to know where it should be going. For instance, you could steer data packets into various clinical algorithms by using the sensor packet itself. So there's a lot of things that creating a wearable device makes you aware of. Again, it's not like you're just sampling how many boxes came over a conveyor belt. So you have to not only be, accustomed to the data, and also in the very basic GXP cloud compliance model, it is dictated that thou shalt keep track of who looked at the data. Well, what better way to do it than to be able to know exactly where that data packet pinged at all of the time?
And touching on that, Shamim, what would you say is part of SafeLiShare's logging mechanism in place to track this data, to track the users, to track the health data? And how is the system monitored for unusual and maybe unauthorized activities?
Interesting question, Walt. So first of all, one of the distinguishing features, and Randy has already alluded to this a little bit, is that one of the distinguishing features of this particular use case is that the data is traveling from the device to the cloud, and perhaps from the cloud to an algorithm, and from an algorithm back to the patient. And so there is this notion of custodianship, first of all. You always have to know who are the actors that are in this process. So I've named 4 actors in this process: the patient, the cloud, where the data storage happens, the one or more algorithms that will get the data, and then back to the patient as well. Unlike some other clean rooms, in which case the data never travels. In this particular use case, the data has to travel between different parties. So the notion of data custodianship becomes paramount, which means that we have to have, as I said before, you have to have a notion of who is receiving the data and are they authorized to use the data, right? And that is why it is crucial to use the public-private key infrastructure along with the secure enclave technology that manages the keys and produces the keys. So Randy alluded to the fact that the secure enclave will produce a certificate that attaches to the protocol that assures that it is the device that is producing the data. On the other hand, in a similar fashion, the secure enclave has to produce the keys that will be used to guarantee that only authorized parties can access the data, or the data is provided only to access parties. So there is a grant mechanism that grants access to the data, and that is also managed by the secure enclave technology.
And in regards to the data itself, so the data is physically stored where exactly in regards to the confidential clean rooms, and in regards to residency and sovereignty regulations, what is the adherence on that?
The data comes from the device into the cloud and is stored in a storage system using in the cloud. And the clean room technology then accesses it from the storage system in the cloud.
Is there any worry of data integrity in this process?
You spoke earlier about the data governance issue and data residence issue. So let me answer that. If the data is resident in the cloud, we always know which region the data is in. And in that particular case, the data doesn't travel outside of the boundary of the region. It's the algorithm that travels to the data, and we call that bring compute to data. So the clean room technology has 2 or 3 different models of computation. One is this bring compute to data, in which case the residency of the data is paramount, and the compute comes to the data, and the data doesn't travel. So that is how we take care of the data residency issue. I've already spoken about the data custodian. In terms of data integrity, the notion of data integrity means that can you trust that the data is uncorrupted from the source itself? And that goes back to the issue of what is the data coming from the device that had the certificate attached to it, that produced the certificate? And is the data now in the cloud? Is it completely uncorrupted and nobody else has had access to the data? And that is provided by all these other mechanisms which I've spoken of.
Randy, if it's okay, I wanted to come back to you for a second regarding clinical technology and really from looking at it from a vendor lens, so to speak. Where would you look at for security practices and certifications for cloud service providers adherence in terms of, what are you looking for as the person that would be engaging with confidential clean room technology or enclave security technology? What is it something that you would be looking for in a vendor?
Well, and it depends on the use case, because I see actually 2 separate use cases for the technology. Depending on whether you're talking so-called GXP security, which is cloud security, which again stipulates that you log who logs into the data, who sees it, where do they go, that sort of thing, as well as HIPAA security standards for protected healthcare information. In addition, entities such as the American Healthcare Information Management Association, who basically sit over data technologies such as what the IHE uses. They basically offer nebulous answers when you ask them about data security. In fact, they'll say, let's just make sure that we're secure for all of our stakeholders. And again, that's one of the reasons that I was interested when developing a device that it not only adhered to commercial standards such as FHIR and HL7, but also had the ability to have some concept of what some would call data provenance, the ability to know where the data came from. And again, existing IoT technologies such as MQTT provide that up to a point. but they're not actually something that you would call an intelligent protocol. And the second use case for that, aside from just what we would call clean room, which would be, okay, I'm going to use this data model to define an AI model. In the clinical research realm, for instance, in QRS prolongation studies, it's very common to want to be able to show to dueling cardiologists, if you will, who are going to be evaluating two separate EKGs, and it's going to be a mass study. And so the ability to know exactly where the data came from, and again, who was handling it all the way down the line, makes a big difference. And so it seemed to be the obvious choice to consider, not only because it was a wearable device, but it was a wearable device that could be used in a clinical research setting.
I wanted to really also focus a little bit on, okay, what worst case scenarios? I know it's not something that is always talked about, but in regards to data breach, in terms of worst case scenarios, how do you look at your incident response time? And this is really more for Shamim and SafeLiShare, but I wanted to look at, what is the response plan in regards to data security, data breach, data compromise? And in that process, how do we handle downtime and data loss?
One of the virtues of secure enclave technology is that the runtime is protected by the secure enclave. Before the data gets to the secure enclave, the data is protected by techniques of encryption, which are called encryption in store and encryption at rest, encryption in transit. So until it comes into the secure enclave, the data is protected by different technologies. Secure enclave protects it at runtime. And the fundamental notion in secure enclave technology is that the data entering the secure enclave is always encrypted and is only decrypted inside the secure enclave. So if you want to talk about a certain type of attack vector, it is, and it's also known as a side channel attack, is that somehow somebody needs to break the security of the secure enclave to get in and look at the data when it is inside the secure enclave. In the very few earlier months of secure enclave technology, there were a few side channel attacks that had been perpetrated. But in the last 2 years or so, last year and a half or so, there have been no side channel attacks that I know of. So the secure enclave technology is quite secure. The saving grace is that if there is a breach, the secure enclave shuts down, and it's the hardware's compromisability that is at stake. So the computation breaks down, and the only contents available at that point are a set of encrypted memories, which, as you know, would not be of much use to anybody that is looking at the remnants of what is left of the memory.
Randy, before we let you go, I wanted to talk a little bit more about technology regarding wearable devices. It's where a lot of the tech is, especially in healthcare. It seems to be the way that we are able to expedite patient care and making companies that are very patient-centric being able to respond to patients' needs in a secure manner. And I was hoping you could just give me a little bit of an overview on, capabilities and really mostly objectives on wearable devices in healthcare.
Yeah, that's a great question, because wearable devices are going to go from being simple data collection devices, such as my Pixie device. It's a data collection engine, if you will, to being more two-way and bidirectional. For instance, if you take any of the Medtronic defibrillator telemetry devices, they have the ability to communicate back to the device and the patient to set parameters, similar to how I would set registers within my device to set particular parameters. So it's going to become even more paramount that we consider not just data security at the end, but data security all the way along. And again, getting back to that smart data protocol. So I think as we get to collecting more data, we're going to be doing more edge processing, but that edge processing still needs to be able to deliver high fidelity data to the cloud as these AI models start generating more and more expertise.
And as Randy just said, The notion that I see becoming more and more important is this notion of end-to-end custody of the data. This custodianship issue is going to be quite paramount.
Mm-hmm. Yeah, and it's, again, not quite addressed. Today, people like to talk of IoT and they like to talk of medical IoT, MIoT, but the reality of it is the way that you send data from one device is not really applicable to the multi-parameter, broad spectrum data that you really need to be able to acquire, not just for physiological devices, but also environmental devices.
As the data gets richer and richer, the problems become more complicated, and the type of analysis you do becomes more complicated, and the type of advice or the directions you send back to these devices become more and more important.
From my perspective, one of the things that I find interesting is that this is just one of the several applications, right? Wearable devices, and but when you start getting into research and labs and bioprocessing and CDMOs and getting a lot of multiple parties involved with a lot of this data, it seems that it would be paramount to make sure that all of this data was secure. The chain of custody, as we've discussed a couple times in this presentation, are absolutely essential. And so it's one of the advantages that we have with SafeLiShare Confidential Clean Rooms. And so I see between wearable devices, the future of where that's going, as you mentioned, MIoT, getting implemented with AI and machine learning in terms of how the data is read, collected. And one of the things that, as I mentioned, is very important that we actually make sure that we know who's looking at what, who's including what data, and making sure that that data is absolutely clean and we know exactly where it comes from throughout every step of the process. Because at the end of the day, with any misstep along the way, it really puts a lot of work behind from multiple parties. So Randy, I wanted to thank you so much for your time today.
My pleasure.
And Shamim Naqvi, I wanted to close with maybe a couple words that you might want to include regarding some of the security regarding health information and across clouds and more importantly into clean room technology.
As you look at this clean room technology and you look at the use case that Randy has very nicely sort of explained, we should understand that what we're really talking about is the underlying trust model. There is a trust model that is needed when we're talking about patient care and complex patient information, complicated, multidimensional patient information, and devices that will process that information, particular analytical types of algorithms that will process that information, and different parameters in these devices that will collect information and process information. We're talking about a trust model. And all of these secure enclave, confidential computing, trusted execution environment technologies, and the protocols that we have discussed are all for the single purpose of engendering a trust model that assures the patient that their data is secure, that the data has provenance, a custodianship, and that the patient can trust the data and trust the advice and the research results that are being sent back to the patient. So I want to conclude with the notion of that this is all to beget a certain trust model that is paramount.
Well, once again, Randall Bardwell, founder of Clinical Technology, Shamim Naqvi, CEO of SafeLiShare Technology. I want to thank both of you gentlemen for your time today. Lots to learn, lots to digest, lots to take away. So thank you both so much for your time today. And thank you everyone who's had a chance to review this. Take care.